Thanks for listening to the Granite List.Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. This is the Granite List.Live, where we explore all things human capital and employee benefits related. I'm your host, Sally Pace, and today we are going to be diving into primary care and challenging you to rethink it. I am joined by Huy Tran, who is with Together Health, and we're really excited about today's episode. We're going to really look at the modern approach that is being taken around direct primary care and what that model looks like. I know you all deliver that care both in person, in office, and virtually, which creates a more seamless experience for the entire ecosystem, for patients, clinicians, and for employers. So we're going to really jump into that. But before we do you mind telling our audience a little bit about you and your background?
Yes, Sally, thanks for having me today. I'm super excited to participate. So my journey of getting to direct primary care is probably not a traditional path. My background over the last, I would say, 15 years has been an HR leader in various organizations, from starting in talent to leading as the head of HR for a few companies over the last several years. But I think when I thought about direct primary care, it was through the lens of how do I serve the employee population that I, as an HR executive, was serving and creating a culture and a company around. And second, from a company perspective, is how do we serve the employees from access to care and affordability, but also making sure we're taking care of the business from a cost perspective. And having just purchased benefits during open enrollment season and seeing the price hikes, but also being a patient myself and seeing the long wait times and access, and a lot of times just having to go to an urgent care or a care now, I felt like, how do I create a model that really serves the employer population and serve the HR executive and allowing them to be innovative when they think about health plans and so forth. And so we created a model that is essentially anyone can enroll. So it doesn't have to be an employer plan. You can go online, Sally, and enroll yourself. But essentially, as we communicate and engage with HR executives and CFOs, we come in and first and foremost, we're not replacing a health plan by any means. But our goal is, how do we keep their employees healthy, but also not increasing their cost as well. And so our model is in-home, in person, so that could be on the job site or in the office. Or if it's something quick and easy, it's a virtual care approach. Also, we are open from 6 a.m. to 8 p.m., 7 days a week. And we do that because we understand people have lives and people are busy at work. And so our goal is, how do we make it convenient for patients to see us and during hours that they need us most? And that's either after work, before work, or even during work, and maybe on the weekend before their families get up and get their day going. And so we don't accept insurance, so we're not billing a payer or so forth. And so that allows employees to help reduce claims, especially those that are fully self-funded. And I'll pause after this, but from an operational perspective, we try to help with productivity. And so the reason why on-site has been an attractive approach for employers is employees don't have to call out and leave the office or leave work or a project for 2 to 3 hours just to go get a physical done. And so we can come in and allow that employee to see our provider in 30 minutes or so, and then they're back to work. And so it's been exciting, and we can't wait to serve our clients and patients.
I do love your story because it is so unique. So many healthcare solutions are often launched by clinicians, people that have been in the direct care space, but you bring such an unusual, in a good way, unusual perspective to this universe. I mean, you literally have been the chief people officer that has been managing the selection of point solutions that you would put into your plans, and then driving the plan members to them. So talk to the audience a little bit about the differences between traditional primary care and direct primary care?
Yeah, so traditional primary care essentially is you are going to a brick and mortar. You have a family medicine provider that you see once a year. You make that appointment and you go in. And I'll share my own experience. You go into the waiting room, you filling out a clipboard, you wait 15 or so minutes, and then a medical assistant or someone calls you to the back. They weigh you, and then you go into the room where the provider will come in and eventually see you. You put on your gown. By that point, that's probably 30 to 40 minutes wait time before even seeing your provider. Your provider comes in, hopefully most and people are healthy. So it's usually a 15-minute, on national average is about 15 or 17 minutes is how long the provider spends with you. It's not because they are rushing themselves or rushing you. It's because the way the system is set up is they have to see so many patients in a day. There's already someone waiting in the next room and so forth. And so let's just say 17 minutes are done and completed. You go out, you get your labs. And so that could be a 90-minute engagement, and then you go home. So that's more of the traditional, I would say, access to primary care. The unfortunate piece is if I wake up and I don't feel well, itchy throat, chills, I can't get in to see my primary care provider immediately that day. And so what ends up happening is I'll have to go to an urgent care. And so going to an urgent care, they don't know me, they need my insurance, there's a copay, I still have to leave the home, and so forth and so on. And the continuity of experience is not the same because you're working with a different provider and so forth. And so now you're out of pocket. That hits a claim for the employer. And so the more claims they have, the higher the rates over time. If they're fully self-funded, then they have to pay on the back end of those things. And so that's the traditional piece. And that's why you see, especially in the state of Tennessee or Texas, so many urgent cares popping up is because primary care providers aren't able to get patients in as quick as they would like. And so where we're different is because we're direct primary care, because we don't take insurance, we're not having to rush the patient. And the way our model works as well is once you are assigned to that provider, you always get that provider. The only time you don't get that provider is if they're on vacation or it's their weekend off or whatever it may be, but there's coverage there. But our goal is to keep our patients with the same provider for the journey and the life of their enrollment with us. And we want that level of experience. And so I think that's the modern approach for us as well as so we can see you on an annual physical. If you wake up and have the same itchy throat, we want you to call us as well. We'll triage, and for patients, is essentially we'll just get on and try to seek and understand what's happening. And then our clinicians have the autonomy to whether make it a home call or if you're in the office or, hey, they were able to diagnose via virtually and get you on your way and hopefully get you to progressing to getting better. And so you didn't have to leave the house. You didn't have to go to an urgent care. You didn't have to see someone new. And so our goal is how do we create that experience for each patient?
And I'm gonna be nosy because you mentioned you don't take insurance, so that's not your revenue model. How are you getting paid?
Yeah, so we have a membership fee. We only have 3 price points. When I started thinking about Together Health, I want it to be as silly simple as possible for patients, like no hidden costs, no complexity and understanding what we do and how much are we. So each enrollment is $42 a month for an individual. If you're an individual plus one, that could be a partner or one dependent, it's $74. And then for the family up to 3 kids, it's $99. So for $1,000, you can cover the whole family with our model. You call us 100 times or one time, there's no additional charge. You want us to come to the home to do a sports physical for your teenage child, there's no additional charge for that. The cost is clear, it's transparent, it's a monthly fee. And so that's how we get paid. And our providers, whether they see 100 patients that day or 1 patient that day, they're compensated as being an available provider for that day. And so think of it as Netflix. I know paying a membership for healthcare or for having access to a clinician is fairly new. Most people typically don't see it. You're actually paying a fee every month when you're an employee and you enroll in a health plan. They're taking it out of your paycheck every month. This is no different. Think of it as a subscription to Netflix or your phone bill, whether you're making 100 calls or binge watching or not binge watching, you're still paying that monthly fee. And so we're essentially the same way.
It's so interesting. It's so fascinating to me to see how the way that we operate in every other area of our life is starting to finally spill over into the healthcare and the employee benefits arena. We built the Granite List to be the same way for benefits leaders to search and source, the same way you would find a restaurant on Open Table, find solutions on the Granite List. So I love thank you for giving that example, because it is so real and it is so close to our team's heart for sure. I mentioned earlier that you have such an awesome background and perspective for doing the work that you're doing. So I know this question should be a layup for you, because you've been the employer looking for cost savings, ways to manage your healthcare spend. So now that you're on the provider side, what advice do you have for employers that are looking for those cost containment solutions?
I'm sharing through the lens of what I was doing leading HR is first and foremost, philosophically, is what's the type of environment and culture you want to have at your company, and just making sure everything else aligns to that, whether it's health plans, perks, whatever it may be. And you're hearing the HR person come out a little bit, but philosophically, if the executive team and so forth is aligned on the mission and what we want to create and foster from a culture perspective, it always starts there. And a lot of times that comes to, do we have the right health plans and coverage and 401k that is going to attract and retain the best talent possible? And if not, how do we go and shop for those things? Now, we still have to keep the lights on. We still have to be financially responsible. And so that gets into, okay, how much can we match on the 401k? And then what type of health plans do we want to select? And so that's so because we're in healthcare and direct primary care, I'll just stick to the health plans. I think as an employer is just making sure you're challenging your broker and understanding, what are the health plans? What are we getting? What are we paying for? What other alternatives do we have? What are strategies that can help us cost save, and while still providing the best level of care and access for our employees? And I think I've worked with some amazing brokers and still keep in touch with them. They've been highly supportive. And the ones that are innovative and creative of like, hey, we understand cost is important this year, rates are going up, here are some ways to help you save costs. And that's where Together Health can come in. Where I get joy, again, we're not a health plan, so I'm not replacing the broker. We need to partner and be an extension of the broker. But with my HR background, we want to be an extension of their HR team to say, hey, how do we help be a part of the conversation? If it doesn't make sense to have Together Health, great. We still serve the client in making sure that they are informed on the best options for them and their team. But if we can make it work, and oftentimes we can, what I will say is, if it's just a cost play, if you're a part of a PEO or fully self-insured, it is hard to articulate a cost savings with Together Health. You can then look at if it's a productivity and reducing call outs and keeping people healthy. If you're tracking those things, we can come in and say, hey, do we help drive more efficiency in the workforce? If it's not cost savings, if it's not productivity, then hey, we just want to be the employer of choice. We want everyone to come work here because we're always going to provide various innovative and new options for our employees and their families. So it just depends on what the employer is trying to solve for.
And I appreciate your transparency around who you are and who you're not. Thinking back to, yes, we all have Netflix subscriptions, but yet healthcare is a slower turtle in that race. As we kind of wrap today's show, do you have any like an aha moment when you're talking to an employer, or a success story that you can share?
I think from an aha moment, I thought this when I started building Together Health. I don't know if it's aha, but what's interesting is I think most employers get excited because they feel like I'm another HR employee for them. So I come in, maybe I should be selling Together Health, but I'm really just selling like us as a thought partner. And I think that's what helps employers. And again, at the end of the day, I want what's best for the employer. Whether we win and we become their client or not, our goal is to serve. And so I just enjoy just bridging the employer-based experience, the HR-based experience in healthcare, and really just creating the best access possible for employers that are looking for ways to manage costs, retain their team, while keeping their teams healthy. And if that's the goal, I think that's where we like to come in and have that conversation.
Perfect. Any success story you can share?
I feel like every quarter, every month has been a success story. Every time someone gives us a call because they heard about us, whether it's through one of our existing clients like Stansel Electric or whomever, like, I heard you were doing this, tell me more. And it just doesn't feel real, one, being an HR person to starting a direct primary care business. And so every time I get that phone call, I'm like, how did we get here? I know how we got here, but it's humbling and it's a blessing to get the outreach and just be helpful in any way in providing shared experience and guidance, whether we win the deal or not. Our goal is just try to help where we can.
Getting referrals are the most expensive free marketing investment you can make, because that's a testament to you and the team that you're doing the job you said you were going to do, and your clients are telling others about it. So kudos for sure, because that is the hardest part is delivering on what you promise. Well, I am so excited. We are so grateful at the Granite List to be able to showcase Together Health. We're proud of the work that you're doing. We love watching the direct primary care space grow and love knowing that you guys are at the forefront of it. So thank you for joining us for today's episode of the Granite List.Live, and thank you to our audience for tuning in.
This was fun. Thank you, Sally, for having me.
Thank you for listening to this episode of the Granite List.Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.